we can prevent high cholesterol, we can stop smoking. For diabetes, yes, diet and exercise can reduce the approach towards getting diabetes. So the one thing I want you to take home, and I'm not going to waste your time, is why your parents are back home and they are well. I want you to talk to your parents, but also talk to yourself to do what we call lifestyle modifications. And how do you perform that? Diet and exercise. And I will focus on exercise because Dr. Jeff already talked about diet. I don't want us to repeat ourselves. So how do you exercise? I know for people to exercise, maybe they go to the park once a month, or once every 3 months, or once a year when there is a convention. But evidence-based practice, of course, a nurse practitioner focuses on evidence-based practice. Evidence-based practice states moderate exercise should be at least 30 minutes to 60 minutes a day, at least 3 to 5 days a week. I know, yes, you want to go clock in. I know you want to go do that overtime. But you have to create time to exercise. You can register in a gym, and gyms are very cheap. You have gyms that offer like Just Fitness or 24-hour fitness for $10 a month. That is less than $1 a day. If you divide it, in fact, it's less than 50 cents a day. And you have 24 hours, 7 days entrance to go there. Or if you want more, some people may want a personal trainer, they may pay more. Some may pay $50 a month, and that is cheaper than one visit to the doctor. I know if you've ever gone to the emergency room here and you get one bill, unless you have to go and apply for assistance, you will not be able to pay. It always ends up in collection. And moderate to high intensity exercise will be things like brisk walking. I don't mean talking on the phone. If you brisk walk, you will be out of breath, you will not be talking on the phone. So when I see somebody doing exercise and talking on the phone, I say you are not doing any exercise. You are just fooling yourself. Cycling, or you go to a treadmill, or you do heavy lifting is the best for us because you reduce weight in your muscles, and that increases your high density lipoprotein, which is very good in helping to prevent arteriosclerosis. And that word simply means the plaques or the blockage in your artery that will cause the high blood pressure, that will cause the diabetes, that will cause the stroke or heart attack. We don't want your parents to die again and you say, you can, I think that is when you don't send money to your parents to go to the hospital.
Okay, when these two people already come to in outpatient care, I'm the last person to see the patient and to finalize everything before they go home and start taking their medication. So I am the pharmacist. I practice at Wichita Falls, Texas, and I've been a pharmacist for 2 years. So the biggest thing when in my practice is accuracy. Every dot, every T, every I has to be dotted. Every T has to be crossed. If I don't see that, then these people will be explaining to me how. So when we get medications, I work with CVS. So when we get medications, they come through a system. Sometimes it's electronic, sometimes it's over the phone, like a voicemail. Also, sometimes it's a fax. So we have a certain time to get it done. So my nature of work is all about boom, 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 boom. So when we get the prescription from them, we transfer it into our language. Our language is supposed to be patient friendly, so that way a 6th grade person will be able to understand. And when we get the medications, we process them. And when we process the medications, we checking every single thing in terms of drug interactions, drug-drug interactions, drug-disease interactions. Fortunately now, with the electronic system, the insurance provides us with some of the diagnoses for the patients. So that's how we're able to find out certain things. The purpose of this discussion is preventative care, is taking that different step to prevent. So my discussion is going to be the medication aspect of it. So the biggest thing, Mr. President have talked about having your cholesterol checked. The doctor have talked about getting your cholesterol checked. I want us to go to another level. So if you go to a doctor, I want us to be the people who are much smarter. So when you go to a doctor, you should be ready to also take that step ahead, even if it's not your field of practice. Learn a little bit about what you can do. Don't just depend on the healthcare personnel, because usually they are very busy, they don't have the time to be able to discuss with you about certain things. So if you go to your doctor and you have your blood pressure checked, you have your cholesterol checked, there is an app that you can go to. It's called ASCVD. ASCVD. You can use that app to calculate your risk of getting a heart attack in the next 10 years. So with that app, it can tell you what level of intensity of treatment for cholesterol you should be expecting to get from your doctor. So we have certain medications. We just generally call them statin. Statin is the first line recommended for treating cholesterol. And if you try one statin, it doesn't work because of a side effect, you have to try another one before you even think about other options. So I want you guys to take that next step, plug into that app, and be able to determine your risk of having a heart attack in the next 10 years. Based on that, that app also tells you your intensity of statin medication, the dose that you should, an idea of how you should be on to be able to help prevent that. So we have different statin. We have Lipitor, we have Crestor, and those different medications can go up to the level of high intensity to control your blood, to control your cholesterol. The reason why I'm focusing on this is because cholesterol will be the number one thing why you have a heart attack. So preventing that is the biggest thing. So it is very good that if you plug that in and you see that, okay, you are high risk, you should be able to be on a statin, have and try and see if your doctor can put you on it. So for some of us that probably are not at that risk, there is just a simple over-the-counter medication that you can get and just take it every day. It will help you in so many things, and that is fish oil. So fish oil, if you're taking just 3, if you go to over-the-counter and you get you're taking just 3 capsules of those every day, it's gonna have a lot of benefit for you. Not only for your cholesterol, it's also gonna be in terms of stress. The way you think. You know how sometimes when you are somewhere and it's a very tense environment, it's very easy. You have red eyes, and you're already showing to people you're being stressed, and you're already showing that life is not easy. Taking that cholesterol every day, I will guarantee you the probability of you having that red eyes, dry eyes will be very low. Almost 2 years ago that I started taking the fish oil, the one I really recommend is Terra, is one that when you go to the eye area, you see that it's called I forgot the name, but it's Terra something. So if you go Terra, so if you get that and you're taking that, it's expensive a little bit. But if you're getting 2 capsules of that every day, it would take you to another level. I tell you, my triglyceride is 32, which is triglyceride is a portion of cholesterol. And I haven't used eye drops for the past 2 years. You have to use eye drops all the time, almost 4 times a day. I don't need to use eye drops anymore. And that you can actually send back home to your parents, because you can actually buy it off the counter and send it back home to your parents. It will really help them also reduce their cholesterol. You don't need a prescription. Okay, so in the pharmacy, we also really care about if a medication is appropriate or not. For us that are African or black, there are certain kind of blood pressure medications that are good for us. If you're going to start someone on a blood pressure medication for the first time, you should at least have those on board. And there are 2 of them, pretty much. Amlodipine and either a thiazide diuretics for people who in healthcare. And if for the first time you're getting diagnosed with blood pressure issues and your doctor haven't put you on any of those, ask what. There could be other reasons why, but if you have diabetes, it will also be good for you to take lisinopril to protect your kidneys. But on board with the lisinopril, you should have the amlodipine to help also with your blood pressure. Reason is lisinopril alone, which is good for white people, will not be enough for us, black people. So you need those.